Hi, we're here with Dr. Tamyra Comeaux. Dr. Comeaux is board certified in OBGYN. She is board certified in anti-aging and regenerative medicine, board certified in integrative cancer care. She is an herbalist and essential oilist and specializes in a lot of things. And she's a big part of our wellness program here at Radiance. So Dr. Comeaux, when I was in family practice, I would see patients with all the symptoms of hypothyroidism. And I would look at their lab test. This was before I got into functional medicine. And I would say, but your thyroid tests are normal. And deep down, I knew that their thyroids were not functioning normally. Since then, thankfully, I've learned about functional medicine, and I know that we need to test more than just T4 and TSH. So when we do screenings, we check 2, maybe 3 thyroid tests. But in functional medicine, we test many other things, including thyroid antibodies. So talk with us a little bit about the diagnosis of thyroid disorder and the treatment.
So I always check thyroid antibodies if there's a question, because when I draw your blood, it's just a snapshot in that one moment of time. And if you have antibodies attacking your thyroid, it could be in the morning they're normal, but in the afternoon after you eat, they're not normal. So, there's a fluctuation in there. So sometimes, we miss the highs and the lows of what's going on. Somebody who's maybe not having autoimmune antibodies to their thyroid might have more stable levels. But if you have some sort of autoimmune issue, levels can fluctuate. So that's one of the things I like to know. If I know that you have antibodies, I usually try to find out why. Do you have enough selenium? Do you have enough iodine? What is going on with your diet? Sometimes gluten is an issue with Hashimoto. Sometimes it's dairy. So we'll address all of those things and kind of see if we can improve the situation that way before you end up on a medication forever. The next thing I know is, as you age, your ovaries stop producing most of their hormones. Your pineal gland stops producing melatonin. So now you don't have estrogen, progesterone, DHEA, testosterone, and melatonin. All that's left is your thyroid to do all this work. So sometimes when I replace all or some of those other hormones, now your thyroid is not alone and it will just improve. So sometimes weight loss is when people have issues with their weight, it might be their thyroid, but it also might be the loss of some of these other hormones. Usually is. And so I try to address the situation that way. So I would say that if another doctor put everybody on thyroid medication for their suboptimal thyroid issues, half of the time I find something else and don't need to always resort to a thyroid medication, because I know that there's just more to that situation than just your thyroid. So everything I do improves the thyroid, whether the numbers say that it needs to be improved. Because once there's help, there's help, and it's going to be more efficient once it doesn't have all of those other things going on.
So if you'd like to see Dr. Comeaux, give us a call here at Radiance.